In daily life, everyone wishes to have a healthy body full of energy. Many people often pay attention to their weight, figure, or test results, but unintentionally overlook the silent signals their body is sending. One of these signals is body odor. In fact, each person's body odor has its own distinctive characteristics. It can be influenced by diet, lifestyle habits, gender, and even genetics. However, when the odor suddenly changes and becomes unusual, it could be a warning sign that your health is having problems. Many serious diseases have been detected from such strange signals. Unfortunately, most of us tend to ignore these signs, thinking they are just personal hygiene issues. But the truth is, some body odors are related to underlying diseases and can even threaten life if not detected in time. So, when your body emits any of the following 7 types of odors, you should be especially alert and ideally see a doctor early for proper diagnosis and treatment. 1. Persistent bad breath despite thorough oral hygiene. Many people think bad breath only comes from poor oral hygiene. But in reality, if you brush your teeth well, use dental floss, and rinse your mouth properly, but still have unpleasant breath, it could be a warning sign of disease. One common cause is gastroesophageal reflux. When stomach acid flows back into the throat, it creates conditions for bacteria to multiply and release sulfur compounds that smell like rotten eggs. Additionally, bad breath can be related to tonsillitis, sinusitis, oral diseases such as tooth decay, periodontitis, esophageal cancer or throat cancer, cardiovascular diseases due to reduced blood flow causing tissue oxygen deficiency and bacterial growth. Especially people who snore or have sleep apnea syndrome often suffer from bad breath due to prolonged dry mouth. If bad breath persists, see a doctor instead of just using mints or mouthwash to mask it. 2. Breath and sweat smelling like rotten apples. If one day you notice your breath or sweat smells like rotten apples, be immediately cautious, as this is a typical sign of diabetes in a severe complication stage called ketoacidosis. When the body lacks insulin, sugar cannot enter cells to produce energy. The body then burns fat, producing substances called ketones. These accumulate in the blood and are expelled through breath and sweat, causing a characteristic rotten apple smell. This is an extremely dangerous condition that can cause coma and rapid death. If not treated promptly, diabetics should pay special attention to this sign and see a doctor immediately if it appears. 3. Strong foot odor. Foot odor is quite common, especially in people who wear closed shoes for many hours. However, if the feet emit a very unpleasant, persistent smell, the cause may be pathological. Athlete's foot, Tinea pedis. The fungus eats into the dead skin between toes, causing itching, redness, peeling, and even blisters. The decomposition of dead skin produces a strong foul odor. Hyperhidrosis of the feet. This rare genetic disorder causes abnormal sweat gland activity. Patients not only have smelly feet, but also breath and urine with distinctive odors. Many people just use deodorant sprays or wash their feet with soap to mask the smell. But this does not solve the root cause. If foot odor persists, it is best to see a dermatologist for proper treatment. 4. Unpleasant fishy smell from the nose. Normally, a healthy nose does not emit unpleasant odors, but if you detect a fishy or foul smell in your nose, possible causes include chronic sinusitis, nasal polyps, sinus infections, post-nasal drip syndrome. When mucus accumulates in the sinuses for a long time, bacteria grow and create unpleasant odors. In this case, nasal drops or saline rinses only temporarily reduce symptoms, but do not eliminate the root cause. Patients need to see an ENT specialist for thorough treatment. 5. Body smells like urine, persistently. When the skin or breath emits a persistent ammonia-like smell similar to urine, it is a warning sign that the kidneys are having problems. Normally, kidneys filter waste and toxins out of the body through urine. But when kidney function declines, urea and creatinine accumulate in the blood and escape through the skin and breath, producing a characteristic odor. This sign is often seen in patients with chronic kidney failure, nephritis, urinary tract disorders. If you notice a persistent ammonia smell despite good hygiene, do not hesitate to have your kidney function checked immediately. 6. Unusual foul smell from the ears. Not only breath or sweat, but ears can also emit odors that warn of disease. Common causes include earwax buildup decomposed by bacteria, middle or outer ear infections, epidermoid cysts in the ear canal, a benign tumor. Besides the odor, patients may experience pain, tinnitus, itching, discharge, or hearing loss. These signs require timely examination and treatment to prevent severe complications, including permanent hearing damage. 7. Body smells faintly like rotten cabbage. This is a very rare but extremely dangerous odor. If your body suddenly emits a rotten cabbage smell despite good hygiene, it is highly likely related to a metabolic disorder called tyrosinemia. In this disease, the body cannot break down the amino acid tyrosine. It accumulates in the blood, causing a strange body odor, often described as rotten cabbage. This disease usually appears in children and is accompanied by serious symptoms: developmental delay, liver damage, hypoglycemia, seizures. If parents notice their child has a strange odor along with abnormal symptoms, they should immediately take the child to the hospital for testing and early treatment. Body odor is often considered a minor issue, but in reality, it can be a valuable signal to detect diseases early. Bad breath, unusual sweat odors, fishy smells in the nose, or strange odors on the skin are silent warnings your body is sending you. Instead of ignoring or trying to hide them, listen to your body more. If you notice persistent strange odors accompanied by abnormal symptoms, you should go to the hospital for timely examination. Timely attention can help prevent severe complications and even save lives. Thank you for watching today's video. If you found it useful, don't forget to like, share so more people can know, and subscribe to the Everyday Life channel to update more useful knowledge about health, nutrition, and lifestyle. Wishing you always health and happiness.